We'll be starting the session in another few minutes. I request everyone to stay back.
Good morning, Dr. Jimmy.
Good morning,
Dr.
everyone.
Sayula.
Thank you all for joining. We'll be starting the session.
Nice to see you.
Nice to see you.
Good. Can you try your screen sharing? Can you just?
Yeah, just 1 minute.
Yeah. Yeah, fine.
Fine, right?
Yeah, yeah.
So shall I stop sharing?
No, no. We will start. Just a few minutes. Give us a few minutes.
Okay, fine.
Good morning, everyone. We'll be starting this session in another few minutes. PA College of Pharmacy, in association with Association of Pharmaceutical Teachers of India, APTI, present an international webinar on COVID-19 pandemic challenges, opportunities for practicing pharmacists. We have our speaker here, and we have all the other dignitaries and the participants here. Thank you all for the joining. We'll wait a few more minutes. We'll be starting the session at 11 a.m.
Welcome, Dr. Pensilvan. Thank you for joining. Dr. Salahuddin is here. Thank you, sir. Thank you for joining us.
Assalamu alaikum. Jazakallah khair. Thank you. Best wishes, sir. Very nice to join.
Thank you, sir. Thank you so much. Our executive director will join shortly. Dr. Raman Dang, Secretary APTI, is yet to join. He will join. Actually, there are two webinars starting same time today. There was little chaos on that.
Dr. Ramandang sir is joined. Welcome, sir.
Raman Dang, sir, thank you so much for joining. Welcome.
Okay.
Our executive director has joined. Thank you, sir. Assalamu alaikum. Welcome to the session.
Alaikum assalam.
You can start, I think.
So can we start?
Yes.
Hello. Okay. So, good morning, everyone. I welcome you all for the webinar, the PA College of Pharmacy in association with Association of Pharmaceutical Teachers of India, APTI, present on international webinar on COVID-19 pandemic, challenges, opportunities for practicing pharmacists. So I welcome you all once again. Thank you all for joining. So I'm the host, Ms. Vijita Pujari K, Assistant Professor, PA College of Pharmacy, will be hosting this session. So PA College of Pharmacy is a budding institute of pharmaceutical sciences committed to quality education and training to build a strong, competent, qualified pharmaceutical force in India. The institute is at another professional educational venture of PA Educational Trust located on the lush green 60-acre campus of PACE Group. PA Group is a pioneering education group running 6 different programs, a School of Engineering being its flagship school, and PACP is another feather to the cap of PACE. The institute is recognized by Government of Karnataka and affiliated to Rajiv Gandhi University of Health Sciences, Karnataka, Bangalore. PACP is approved by Pharmacy Council of India and All India Council for Technical Education. The institute is running BPharm and DPharm courses with the intake of 60 students. The institute is offering quality education with enviable infrastructure, a spacious and well-equipped laboratories, well-maintained library, boys and girls separate hostel facilities, transportation facilities for day scholars, banks, ATMs, cafeterias in the campus. The most importantly, a serene place for the education away from the buzz of the city is offered by the institution. A PA College of Pharmacy offers quality education with enviable infrastructure. So PA Educational Trust, which is continuously striving to produce well-qualified, competent, and focused professionals through different programs, major being college engineering, other include Polytechnic, First Grade College, MBA, and Physiotherapy, which is a recent addition. And PA College of Pharmacy is committed to quality and work ethics. A college therefore adopts regulatory requirements for the safety of as its staffs and students. Gender inequality, anti-discrimination, and anti-ragging committees have been formed as per the norms and very strictly followed. And PA Educational Trust, which is continuously striving to produce well-qualified, competent, focused professionals through different programs, being college engineering and other include Polytechnic, First Grade College, MBA, and Pharmacy, which is a recent addition. It is a well-furnished college, and admissions are open now. Now I request our principal, Dr. Salimullah Khan, to welcome the gathering. Sir, over to you.
Thank you, Ms. Vijita, for that nice introduction of the college. Before I start with the welcoming, I just like to brief about this webinar. This webinar is very important. There are several webinars going on around us during this pandemic. Several people have, organized very good webinars in various fields. We thought it is pertinent at this point of time to educate the community about the COVID-19 and especially the role of pharmacists in COVID-19 and the challenges the pharmacists facing in this pandemic. Especially there are several strata of healthcare professionals, and generally doctors and nurses are bearing the brunt for sure. At the same time, pharmacist is not lagging behind, and pharmacist is having his own way, own risks and challenges, and we wanted to highlight about that. And when I happened to meet one of my colleague, Dr. Jimmy Jose, who was my colleague in Manipal. Then when we discussed, then when we asked him, he readily accepted to deliver a talk on this topic. So that is how this idea culminated into a webinar which we are, witnessing today. So having said that, I would like to welcome all of you on board for this international webinar. First and foremost, I would like to welcome our Executive Director, Mr. Abdullah Ibrahim, for this session. And welcome, sir, for this session. When I asked support for this webinar from Association of Pharmaceutical Teachers of India, the Secretary of APTI, Dr. Raman Dang. Dr. Raman Dang is associated with me for a long time. He's a friend and philosopher, guide for me, and a well-wisher of our institution. He readily accepted to lend support to this webinar. Thanking him, I welcome you, Raman Dang, sir. Welcome to this session.
Thank you, brother.
And I welcome Dr. Jimmy Jose, who was the center of attraction today, the person who is going to deliver a talk on this very important topic. Dr. Jimmy Jose, thank you so much for, first of all, for accepting our invitation, and welcome to this session.
Yeah, welcome, Dr. Salimullah.
Thank you, sir. I welcome all other dignified members. The Director of Academics, Dr. Sarfraz Hashim is here. Chairman BOS, Dr. Salahuddin is here, and Dr. Shabraya, our very important, very good well-wisher of our institution. Dr. Shabraya, Principal, Srinivas College of Pharmacy is here. Likewise, Dr. Manjuna Shetty is here. Many others. I'm sorry, I'll not be able to, take everyone's name.
Hello.
Thank you everyone for joining us, and welcome all of you to this important webinar. We have registered around 200 members, around 80 have joined, and surely in another few minutes, more are going to join. Thank you once again, everyone. And everyone, I welcome my colleagues, especially who have taken pains to, organize this webinar. Thank you, one and all, and welcome once again, everybody. Over to you, Vijay.
Thank you, sir. Now we'll start the webinar session. Before starting the webinar speaker, now we have inauguration session. I request Mr. Abdullah Ibrahim, Executive Director, PA Educational Trust, and to inaugurate the webinar. And I also request Dr. Raman Dang to join the inauguration. So over to you.
A very good morning to one and all. I'm very happy to have our esteemed speaker, Dr. Jimmy Jose from the University of Nizwa, Sultanate of Oman, and Raman Dang sir from APTI. And I appreciate Dr. Salimullah Khan sir, who has taken a lot of effort to organize this wonderful webinar. The COVID-19 SARS virus has brought the world to a complete standstill. People from all walks of life have suffered great consequences. This virus, which is believed to have mitigated from bats, has posed serious threat to the humanity and security at large. Law enforcement professionals, healthcare professionals in particular, doctors, nurses, sanitary workers, ambulance drivers, all the frontline workers have been at the highest risk and have laid their life on the line for us. Pharmacists, being a very important part of the healthcare system, have a huge risk of life. Different categories of pharma professionals have had different challenges and also opportunities to serve the people. The hospital and clinical pharmacist, being in direct contact with the patient, is at equal risk as that of any other healthcare provider. Community pharmacists are at a lower risk but have a higher responsibility of monitoring over-the-counter drug usage and report any cases based on the medicine being used. The industrial pharmacists and chemists have worked day in and day out to make sure the availability of essential drugs. Pharmacists in different parts of the world at different levels have had varied levels of challenges and opportunities. Today, the speaker will deliberate a lot on these challenges and issues. I invite you as well to inaugurate this session with us.
Sir, put your cursor on that one and inaugurate.
Sir, Ramandang sir.
Yes, sir. Yeah, I'm there.
Sir, wait. Yeah, now exactly in the center here. Thank you so much. Thank you, Ramandang sir.
Thank you. Thank you so much, sir. So I request Dr. Ramandang, Secretary of APTI, to give a forward about today's occasion.
Hi, good morning, everybody. So congratulate the PA College of Pharmacy, the PACE group of institutions, Dr. Salim, my friend, my brother, and a very dynamic person, Dr. Mohammad Momin, the convener of and madam for today's function, and our Dr. Jimmy Jose. Entire team I would like to congratulate, because the topic you have chosen is very much that is required. For the simple reason is the other day we were having a webinar with a person from USA. So what we could analyze is the lockdown, did it really solve the purpose? So they said the WHO had given the warning signal in the beginning of March. Had the lockdown been in the first week of March, obviously we wouldn't have been in this stage today. I think the speaker, the resource person of today will agree, because what happens is now we have gone economically down, again cases are coming, community transfer is happening, migrants are being sent from here to there, again we are getting the people from abroad. So I think it's a total chaos now. US and India have suffered, other countries, Europe, and even if you see Pakistan, if you see Sri Lanka, many of the countries have stabilized themselves, seeing the conditions in India, in US, and in Brazil. So my dear friends, I really wish good luck, and I would be very much part of this interesting topic, what you have chosen, because this is the need of the hour now. Now we need not, what I say is we need not get into more antigen checking. We should see the antibodies that are being produced by us. Only hope we have is if herd immunity happens, then yes, we can save ourselves. We have to take protection. We definitely have to wear a mask, distance, and see that sanitization is done. There is no other way we can control the pandemic now. We cannot have any more lockdowns. We cannot have the standardization and anything to do with pandemic now, because vaccines are being tried, things are happening, and really I pray to the Lord that all of us should be healthy and we should serve the profession and see that there is an outcome and there is a stop to this nuisance that has happened throughout the world. So friends, I hand over the session to you to take charge and wish you very good luck from APTI and from myself. Have a good day.
Thank you, sir.
Thank you. Thank you so much, sir. Now we have a profile reading of the speaker. I request Ms. T.C. Aishwarya, Assistant Professor of PA College of Pharmacy. Over to you, Aishwarya.
Thank you, Vicheta. Good morning, all. Dr. Jimmy Jose is presently working as Associate Professor in Pharmacy Practice, Clinical Pharmacy in School of Pharmacy at the University of Nizwa, Sultanate of Oman. He additionally held the positions as Assistant Dean for Research at the College of Pharmacy and Nursing. His previous major academic appointments include International Medical University, Malaysia, and Manipal University, India. Dr. Jose was awarded his PhD in the year 2008 from Manipal University, India, and the field of research was pharmacovigilance. He is presently undertaking a postgraduate professional development course in pharmacoepidemiology and pharmacovigilance from London School of Hygiene and Tropical Medicine, University of London. He had the opportunity to receive training in clinical pharmacy at Michigan Hospitals, University of Michigan, USA, as a part of PharmaBridge program of International Pharmaceutical Federation. His academic teaching experience include in postgraduate and undergraduate level, MPharm, PharmD, MPharm program, a twinning program which at the IMU with University of Strathclyde, UK, and BPharm in Oman, Malaysia, and India. He had the opportunity for bedside teaching as part of mentoring postgraduate and undergraduate students during their clinical attachments in India and Malaysia. He was invited to be an external examiner for doctoral and master level theses within and outside Oman. Clinical experience includes part-time clinical pharmacy services in the Department of Medicine in Nizwa Hospital, Ministry of Health, Oman, and Department of Medicine, Kasturba Hospital, Manipal. His non-academic experience includes in medical writing and healthcare communication as Deputy Manager, Media Health, Bangalore, and as Production Executive, Strides Aircolab Limited, Bangalore. His primary field of research is hospital-based pharmacovigilance. Additionally, he has done research work in the field of patient medication adherence and knowledge attitude and practice of public or patient in drug use related aspects. He was successfully in obtaining research funds from Research Council Oman and from University of Nizwa, along with a multidisciplinary team in multiple occasions. He has received travel grants from the international organizations as International Society of Pharmacovigilance and International Society of Pharmacoepidemiology. During his research career, close to 45 articles are published in peer-reviewed journals, and the publications have received more than 1,080 citations, in which had H-index of 13 and item index of 17. He serves as an associate editor for the journal Pharmacoepidemiology and Drug Safety, and as an editorial or advisory mode member for the journals International Journal of Pharmacy Practice, European Journal of Pharmacy, Hospital Pharmacy, Drugs and Therapeutics Perspective, and Therapeutic Advances in Drug Safety. He has rendered services to pharmacy and other healthcare professional community in Oman, including association with the Pharmacovigilance Department at the Ministry of Health, Oman, in conducting pharmacovigilance workshops, as well as educational presentations at various other conferences and workshops. He serves as a member of Patient Safety Curriculum Committee, as well as a Regional Research and Ethics Committee of the Ministry of Health, Oman. Thank you. Over to you, Vicheta.
Thank you, Aishwarya. Now, the moment we are all waiting for, that is our speaker, Dr. Jimmy Jose, Associate Professor in Pharmacy Practice, School of Pharmacy, University of Nizwa, Sultanate of Oman. Sir, over to you to start the session.
Please share your screen.
Yeah. So good morning, Dr. Salim. Can I start?
Yeah, please, sir.
Yeah. Okay. Okay, so first of all, a very good morning to all, and I would like to thank Mr. Abdullah Ibrahim, Executive Director of PACT, and Dr. Raman Dank, the Secretary of APTI, Dr. Salimullah, and Dr. Mubin, and all other members who have been present here, and a very warm good morning as well as wishes to all of you. Right. Yeah, first of all, before I start, I would like to thank the organizers for inviting me to be part of the program, right? So as Dr. Salim was mentioning, it was been just by, just by chance, 1 minute. Yeah, we were discussing about as well as, finally it came to the part we are conducting a webinar right now. right? And before I move on, like I would like to thank Ms. Vijayda Pujari for using as being a host, as well as Ms. Aishwarya for giving a brief introduction about my profile. I'm thankful to all of you, right? So that's it. Like and before I start, I think like as Dr. Mr. Abdullah was mentioning, as well as Dr. Raman was mentioning, I would like to appreciate the dynamic leadership of Dr. Salimullah. Like I think I should thank Dr. Salimullah like for selecting this topic. It's not me that who has selected the topic. It was basically like Dr. Salimullah has suggested this topic, and I was happy, right, while I was interacting with Dr. Salimullah, his vision as well as his ideas regarding pharmacy, as well as ideas regarding webinars and all. Like I did share with him as well. Like I was been quite happy to see that Dr. Salimullah is thinking from various angles to ensure like people are getting the benefit out of conducting a webinar, right? So as much as possible, a topic that is of relevance for everyone, as well as people should get the benefit, rather than just conducting a webinar. So I really appreciate Dr. Salimullah for his visions, as well as towards education, as well as like training, right? So this topic, what I'm going to give to right now over here, let me just see. Yeah. So it's a COVID pandemic, challenges and opportunities for practicing pharmacist. Before I move on to my slides, like for people who are not aware regarding where exactly I'm working, I'm basically from Kerala. I'm basically from Kerala, like a place Kottayam. Right now, I'm in Muscat, Oman, from last 10 years. I'm working in a university, that is University of Niswa. That is somewhere over here, around 150 kilometers from the capital, Muscat. And just showing a picture of our market, or we call it as a souk in our town, Niswa town, like because Niswa is considered as an Islamic capital of Oman, as well as it's a major tourist destination. So the objectives of my presentation, like probably like next 45 to 50 or maximum of 1 hour, like this is what I've been trying to do. Like we are trying to identify the important challenges encountered by practicing pharmacists during the COVID pandemic, analyze the methods employed by pharmacists to adapt to these unprecedented situations and overcome these challenges, identify the opportunities opened up by the situation for the practicing pharmacist. And this presentation, I would like to give some information regarding the presentation. So this presentation I have prepared based on the literature review over a period of 6 months on this subject. I think almost the time from which people started becoming aware about this COVID, as well as like articles getting published on COVID, as well as my ongoing interactions and discussions with the practicing pharmacists, community, hospital, and clinical pharmacists from few countries over this period. Right now, as is mentioned in the introduction, like basically from the clinical pharmacy background, so I've been working as a part-time clinical pharmacist in Manipal, as well as in Niswa Hospital in. And in addition to that, like right now, like from last 4 or 5 years, and I'm not going for clinical rounds because of my other commitments. So I'm not sure. I mean, like I'm not a frontline worker right now. So my opinion, as well as my discussions, is not the experience of a frontline worker. Rather, based on the literature review, based on the interactions with frontline workers, as well as my personal opinions, as well as observations that's been happening over the last 6 months, right? And there is lots of information that is available in the literature on COVID, as well as the role of pharmacists, the challenges and opportunities. So right now, whatever I'm going to present is not inclusive of all the information that is available. Rather, it is just a representation of the same, right? And the situations, the challenges and opportunities faced by pharmacists and other members in the society might differ depending upon various factors, as well as the individual work settings. As everyone knows, over here, yeah. The present challenges of pharmacists are, or the present challenges that we are, all of us are facing, right? It's been quite huge, right? And people have been affected, as Mr. Abdullah Ibrahim has rightly mentioned. Like, there is no one that has not been affected by the COVID-19. COVID-19 has affected people from every walk of life, one way or the other, right? And right now we call it as like unprecedented times, like a situation which has not been expected or situation which we have not seen before. So definitely when we have a situation that's not been seen before, right, we require measures which are unprecedented. We have to take measures which have not been used before, as well as we have to come out with like measures to tackle these unprecedented times as well as challenges. I think this is the approach that everyone has been following. So no one can escape from COVID as of now. So as Winston Churchill has mentioned, like if you are going through hell, we have to keep going, right? And the best thing that we can do right now is to keep calm and carry on, like as the British government has informed or like shared with the soldiers during the World War II, right? At the same time, we all of us are hopeful that this time shall also pass, and we'll come back to a normal situation, though we are not sure like when it would be, like at least a near normal situation in the future, in the near future, right? So if you look at the literature and if you look at media, as well as if you look at the scientific literature, we can see that there are lots of articles that have been published or like write-ups being written regarding the role of pharmacists in COVID-19, what kind of role they have been playing and what kind of support they have been receiving. And this is something which I've observed as something which has been interesting. Like it's a Twitter tweet by Mr. Boris Johnson, the Prime Minister of UK. So he has written something about a pharmacist in the way back in the end of March. So he has been singling out pharmacists, the wonderful pharmacy profession, and praising them, as well as they thank the pharmacists for their role in dispensing vital medicines and providing reassurance for customers they interact with. There was something like a real boost, I suppose, like the pharmacists in UK, as well as people who have been reading outside of UK as well, right? People have been recognized, though we don't see such write-ups or such recognition that's been given for pharmacists world over, like not so frequently. But the other side of the coin, we know that it's not like everything is on the positive side, like or all the news have been only on the positive side. Like pharmacists have been facing the brunt, like you can see, as you could see here, like people have been facing abuse and aggression and violence during their work settings. So what I'm trying to do over here, it's like I'm just trying to encompass or like summarize the challenges faced by the practicing pharmacist and the opportunities gained. So I should stress on one particular aspect, that I'm not going into the challenges faced by people in industry, and either the challenges faced by the people in the academic sector or the regulatory sector. I'm just concentrating on the challenges that has been faced, as well as opportunities gained by the practicing pharmacists, the community pharmacists, the hospital pharmacists, clinical pharmacists, as well as those working in the specialized area, right? So only those related to the practice of pharmacy or the pharmacy practice related aspects. And of course, like when there are challenges, there should be opportunities as well. Like the wiser people will identify opportunities from the challenges, right? So during our darkest moments, that we must focus to see the light, and we should utilize these opportunities, we should utilize these challenges to identify opportunities which are being beautiful as well as powerful. Right? To start with, like I will discuss about the challenges and opportunities that's been observed in the community pharmacy. Right? We can see that community pharmacy has been challenged to perform under different as well as difficult circumstances during COVID-19. And trying to discuss like summarize the major aspects I've observed from these three articles. The challenges faced are regarding the provision of medicines, right? So the major role of pharmacists who are working in the community setting is basically to ensure that the medications have been made available for the community as well as for the customers on a regular basis. So this face challenges in ensuring the continuity of provision of medications, right? Considering the manufacturing being affected in some countries, distribution being affected in some countries, and so on. the delivery services has started, like since the patients and customers who have been elected in visiting the pharmacies, and especially elderly and people, vulnerable people who have been requesting for delivery services, like the pharmacies had to initiate. I think there's some hindrance. Okay. So there was a need that delivery services to be initiated, and hence the pharmacist has lost the opportunities to discuss the medication-related problems while there have been the delivery services. But again, in some countries, they have that has been overcome by the initiation of telepharmacy and all those aspects, which we'll be discussing later. And during this time, to reduce the visits of the patients as well as the customers, like probably like in many cases, like the supply at one point of time has been increased. So people have been supplied with more medications at one point of time. But of course, we can see that we know that like when the supply has been increased, there are inherent risks when you're increasing the supply, right? So that was one aspect to be considered. If you look at the workplace, like there is increasing workload that has been happening, like due to various reasons, like due to the change in the time, due to the influx of public for stockpiling and all those aspects, like there was increasing workload. There was threat of infection due to the insufficient workplace distancing, and I don't think like in community pharmacy, like people have been working wearing the PPE, right? So the patient aggression was one factor because many times patients were being concerned when the medications were not available, and in some cases, like and some places, like the prices of masks and some other aspects went up, right? So this resulted in the patient aggression, and it had financial implications to the business as well. On the personal life, many of this particular aspect is not being or been given much importance by like the community, because the personal life of professionals have been affected, right? So a healthcare professional is the same as any other person, like who have been worried regarding the infection, who have been worried regarding the risk of infecting loved ones and their own personal worries. Things have been changed, like people are not being able to send their children for child care, so they had to manage by some way or other. So there were lots of issues which were being faced by the community pharmacists. At the same time, there have been opportunities for the community pharmacists, right? We can see that like the community pharmacists have been recognized as frontline members as well as essential members of tackling this COVID pandemic. And they demonstrated the needed roles in an emergency situation, right? In an emergency situation, in a public health situation, community pharmacists have a major role to play. At the same time, they reinstated, right? So they ensure that they have essential contributors to public health, and the community pharmacists should be further integrated into the public health system, as we can rightly understand, like in countries like in India, like not only in India, I think in many places, like the community pharmacists are not well integrated in the public health system, but the COVID-19 has shown the way that, okay, the community pharmacists are also supposed to be integrated into the public health system. And they have shown the critical contributions that they can make during an infectious disease outbreak. And they have been recognized as people who have been highly accessible both temporarily at one point of time as well as geographically. They are the people who have been highly accessible. Though every time, like we used to discuss, like community pharmacists are the first point of contact for the patients or public, it became in reality during this COVID pandemic, when the patients or public were not able to meet doctors, when they were hesitant to go to the clinics. So the community pharmacy were the place where they were able to go, and especially in places where the clinics were being shut down, or like places where the clinics are not available, community pharmacies were the place where people are taking shelter in discussing about the medications or discussing about the worries on the disease and all those aspects. And they acted as a source of informing, advising, and educating the community. So more than ever, I think like the COVID has shown a way in which the community pharmacist has been involved in health education, right? So if you take the case of our own country, like in India, like the amount of interaction that's been happening between the patients or customers and the community pharmacist is limited, right? I hope like during this particular time, definitely there was instances where the pharmacist had to interact or the patients had to interact. More than the pharmacist, I think that there were situations where the patients felt like interacting with pharmacists as a healthcare professional. Earlier, when they used to consider pharmacists or community pharmacists purely or like to good extent as a business person. So right now they understood that, okay, these are the people who have been there when there is a health crisis, and they're the people who have been available for us to discuss as well as to support us. And in some countries, like the community pharmacists acted for COVID testing, because I was discussing with my few colleagues or the friends in the US, like they have been involved in COVID testing by nasal swabs. And some countries, like you can see that the pharmacists have been involved in monitoring, for example, like blood pressure monitoring or blood glucose monitoring. When the patients who have been chronic disease patients who are not able to go to the hospital or the laboratory, they have been able to do the blood test in the pharmacy, and accordingly they have been able to monitor the disease as well as the progress. And the community pharmacists who have been supposed to screen the suspected cases and make appropriate referral as required. And even in India, I suppose, like people have been asked to keep a record if patients have been buying paracetamol or like other products which have been used to control the symptoms of suspected COVID, right? So they have been asked to monitor as well as to keep a record. And again, this is a way of making appropriate referral or like some sort of linking with the public health system. And during this time as well, like the pharmacist has played a major role in preventing as well as managing the common diseases, right? So they were able to respond to the symptoms and manage the minor illness, as well as respond to the symptoms, as well as providing them with the OTC medicines, right? And more than ever, like I think this particular aspect or this particular role has come into picture, because for the minor illness, the patients were not going to the clinic, and they have been trying to depend on the community pharmacists to provide them with the OTC medicines. And hopefully, like God willing, like if the vaccines are made available, once safe vaccine, as safe as well as effective vaccine is being made available in the world, like pharmacists may not be in India, because we pharmacists in India are not been trained for I think like administration of vaccines, but in countries like US as well as other countries where pharmacists are being involved in administering vaccines as well as flu vaccines and all. So definitely pharmacies will be a place wherein like they will be involved in vaccine administration. So basically we can see that there is a need as well as there is further scope to expand the role of community pharmacists through renewed legislative changes, research studies, and collaboration with other healthcare professionals. And of course, like this is a time like pharmacists, the community pharmacists took up the role in which they became like someone who was caring for the patients as well as the public's health needs. Hospital pharmacy has been a transforming experience for the hospital pharmacist. And what I'm discussing is based on these two references, though there are lots of references that has been available. I'm just trying to summarize based on these two references. The challenges faced are the logistics of drug and medical device procurement. So the hospital pharmacist has to ensure that the drugs as well as the medical devices are available in the pharmacy. And they will be involved in selection, standardization, and follow-up of treatment for COVID-19. As knows, like the recommendations for treatment of COVID has been changing right from February, right? So it keeps right? And we can keep being modified. And accordingly, the pharmacist has to be has to play a major role in selecting, standardizing, and following the treatments for COVID-19 from the evidence that has been available. So whatever literature that has been available right now, it is limited. So the pharmacist has to be one step ahead in data as well as providing recommendations and answering to the queries from the doctors and all. The hospital pharmacists were working in a different setting. They had to ensure the safe drug dispensing and storage of medications in the hospital wards and unusual facilities. As you might know, like there were places, hotels have been converted into like facilities, like ICU facilities, not ICU, like treatment facilities. And there are makeshift hospitals that has been made, or the nursing homes has been converted into hospitals, and there have been different changes that has been happened. So the hospital pharmacist has to ensure that the storage as well as dispensing of the drugs have been happening in these places, though they are makeshift arrangements. telepharmacy services has been initiated for outpatients, which is something just not very much, efficiently been practiced by many places. So they had all of a sudden to start initiating it. And again, the drugs that has been used for COVID, right? So some of the drugs that has been used for COVID, like it has been used in a different situation right now. So accordingly, like the drugs that has been used by the patients might be different. So the chances of multiple drug interactions and safety problems has to be looked into. And some places there has been say that people who have been going, like from the pharmacy team, like people who have been going to the emergency department, so they had to restrict the entry of these pharmacists going to the emergency pharmacists, going to the emergency department. Their entry to the general pharmacy service area had to be restricted to the risk of cross-contamination in some places. And again, the drugs which has been sent to the emergency center couldn't be returned to the pharmacy service area due to the concerns of like infection and all those aspects. Opportunities were there at the same time. So the teleconsultation was being initiated and people were been coming out with innovative approaches, right? As you know, like hospital pharmacists were coming out with innovative approaches to counsel the patients as well as to ensure that the patients are being adhering to the treatment by use of videos, chats, among others, and communication channels. And the role of pharmacists in clinical research teams has been involved, like the clinical research has been conducted in the various hospitals. And accordingly, the pharmacists who have been involved in the clinical research related aspects. And definitely, I think the visibility of pharmacists in the eyes of patients, professionals, and society in general has definitely strengthened. And there was an identification that the hospital pharmacists need to be integrated into the emergency care services, right? So an emergency care pharmacists who have been involved in ensuring that has to be of information and communication technologies applied to the telepharmacy, like the information and communication technology has been boosted to ensure that like telepharmacy and other measures have been played into picture. In clinical pharmacy, a rapid changes has happened in the way the clinical pharmacy is being practiced. There have been disruptions in the practice, right? In many places, I think the clinical pharmacists who used to be along with the doctors who used to be most of the time been functioning within the wards. So their place of work has been lost in the sense like in many places, there have been instructions to reduce the presence of healthcare professionals in the critical areas. And thereby the clinical pharmacists had to work remotely. So they're not having the opportunity to go to the rounds as well as being along with the professionals, healthcare professionals. So they had to work remotely, right? And there was less chances of interactions because they have been working remotely, then there was less chances of direct interaction with patients and healthcare professionals. And pharmacists had to manage the drug shortages as well as patients' medical complexity, right? In one article, it was written like, normally like for intubation, like probably like, normally if 2 or 3 drugs were being used, but in these cases, COVID cases, they had to go for 4 to 5 drugs to be used, and accordingly, the patient's medical condition was been complex, and accordingly, the number of drugs that is required as well as the kind of drugs that has been required has changed, and the pharmacist has to make sure that these drugs are being available in the pharmacy. And in between, the clinical pharmacist has taken up some new roles, has identified some new opportunities. And there was a write-up on the role of emergency medicine pharmacists, right? An emergency medicine pharmacist has become a member of the airway management team, right? And the airway management team is basically responsible for doing all endotracheal intubations for patients with COVID-19. And how exactly the emergency medicine pharmacists played a role? They helped in developing a medication kit for the specific purpose with neuromuscular agents, right? And they were helpful in facilitating the rapid delivery of medications that is required for the airway management team. They were experts in medication selection as well as dosing. They were preparing like the recommended medications. So they had to go for preparation of the medications depending upon the patient's condition. And they had taken up other roles in developing the policies and procedures. Though they are normal jobs of pharmacists, but over here, they had to develop policies, procedures, protocols, and provide medical advice to frontline medical staff with limited evidence. That was the major difficulty that I think that people have been facing, right? So normally, like we had to come out with protocols after some amount of evidence is available. So right now, they have faced with a situation wherein like the doctors will depend upon the pharmacists to give them the most up-to-date information. And the amount of information that has been available in literature, it's been limited. So they had to come out with some suggestions as well as policies along, working along with the multidisciplinary team with limited evidences. And at the same time, we cannot say like since it is a critical situation, the rational use of medications need not be considered, right? So we had to ensure, the pharmacists had to ensure that there is less of medication errors and there is less of issues with regard to the rational use of medications. And they had to recommend medications for the nurses, physician colleagues, manage sedation charges for patients who have been intubated, and all of the new roles that has been coming up as part of it. And I'm not going to the details of these two pictures. It's basically like from an article from that was published in Research in Social and Administrative Pharmacy, based on the experience in the Fine Shelter Hospital in China. So wherein like they have come out with various innovative pharmacy services as part of their clinical pharmacy activities. And this is how they have come up with the health pharmacy services, wherein they have utilized various communication strategies using multimedia health education, cloud pharmacy care, live broadcast of recorded courses, right? So again, it's from the same article published in Research in Social and Administrative Pharmacy. So these were the articles which I used for discussing about the role of clinical pharmacists. At the same time, there was special scenarios that has been come up for the pharmacists to play, because there were, as we know, like there are certain medications which require a specific laboratory monitoring when the patients are on such medications. If you take the example of clozapine, an antipsychotic drug, usually for dispensing of clozapine, like while the patients have been given clozapine, like they require that the blood monitoring tests have been available because it's a drug known to cause blood disorder. So the patients were, or the pharmacists were in dilemma regarding the ability to dispense this medication because the lab tests were not available, right? And patients who are on the management of opioid use disorders, like again, the rules and regulations, the pharmacists cannot change the rules and regulations unless the regulatory agencies or the competent authorities change the rules and regulations. They have been in a dilemma regarding how exactly to proceed with managing patients with opioid use disorders. Oncology practice, the patients with cancer, like regarding the use of these anti-cancer medications, regarding the storage and all those aspects, has been becoming a dilemma as well as a concern for pharmacists. Another major part or another important emergency that has been come across right now in the digital age along with this epidemic is infodemic, right? So I hope like most of you might have heard about this term infodemics. So infodemic is basically a blend of information and epidemic, right? So that typically refers to a rapid and far-reaching spread of both accurate and inaccurate information about something, such as a disease. I think like all of us has experienced it, right? On a daily basis, like at least we'll be receiving in our WhatsApp at least 5 new messages regarding COVID, the treatment, regarding the spread of the disease. Some of them are accurate information, and many of them are inaccurate information as well, right? So some information that we are receiving are accurate, and many times that we are receiving inaccurate information. So that is basically called as infodemic, right? An epidemic of information, right? So the digital age has resulted in it. I think right now, compared to maybe 20 years back, right now, everyone in the public has a say about the disease as well as the treatment. Because we can say that like everyone is Google patients or the Google doctors, right? So everyone knows something about everything, right? So it is quite difficult to convince them as well as because they feel that, okay, we also have access to the information, accordingly we know about it, right? So it is very difficult to ensure that this infodemics or the inaccurate information is not negatively affecting the people regarding the spread of the disease, the treatment, and so on, right? As the WHO director has rightly mentioned, in this era, we're not just fighting an epidemic, we are fighting an infodemic, right? Because this information, like information overload, has sometimes a negative effect on the public as well as sometimes on healthcare professionals as well. There is proliferation of fake medicines, fake news, and medication misinformation that is surrounding COVID-19. Pharmacists, they are key healthcare professionals, especially clinical pharmacists or pharmacists with an advanced skill in the literature research. They have the required skills in obtaining appropriate information on a medical subject or a medication-related subject, and they have the training in communicating it effectively to the public as well as to the patient. So they have to play a major role to contribute to the fight against this infodemic. I feel like everyone is facing it. Anyone from the healthcare sector has been facing questions from the public regarding, okay, is there no vaccine that has been still available, or when the vaccine will be available, and why people are, why after having so many researchers in this world, like why the vaccines are not being developed, and why if the vaccine has already been developed, why it is not coming to market. So it has become quite difficult to to convince people regarding these issues, as well as them to understand how exactly the medications are coming to the market or vaccines have been coming into the market. I think one way there was a positive side, like the COVID, that people or the public has understood to question how difficult it is to bring medication to the market, right? So why medications are usually initially so expensive, the amount of time as well as the amount of effort that has been put in by different individuals to develop a molecule and bring it in the form of a medication. So how difficult it is, right? So many times people were not aware about it. So people who have been not concerned about like how the medications used to come into the market, but now they are more aware and they appreciate how exactly the medications have been brought into the market. I think from the lighter side, I have seen a note that has been written somewhere where like someone was asking a virus which can be killed by a soap that could be bought by 30 rupees, right? So why people are not able to find a vaccine for this virus, which could be eliminated by a soap which could be bought by 30 rupees or 50 rupees. So that is why people are looking at it. Why people are, even though the vaccine is available, like why it has not been, like the vaccine has been developed, why it has not been available to the public. And many times people are thinking that it is something where like a conspiracy from the pharmaceutical industry or the medical side, so that they are delaying the initiation of or the introduction of vaccine or something of that sort. Like, because I heard from my friends who have been telling like to a good extent this whatever has been happening has been like something fake to benefit the pharmaceutical industry. So I was just asking them, like right now, I think the pharmaceutical industry is basically at a loss right now because of the disease, right? They're not going to get much benefit by bringing out a vaccine, right? So it's basically people have different information and different opinions. So it's very important that we provide accurate as well as reliable information to the public on these aspects to ensure that these wrong information is not been passed on, which might affect the way they behave, which might affect the way they behave as well as they spread the disease, people spread the disease as well. And right now, that was regarding whatever information I obtained from the literature. So I would like to share now some real life experiences shared by pharmacists from few countries. Like I did discuss with a pharmacist from a community pharmacist from India, asking him regarding the challenges that he has been facing. So the major challenges that he was mentioning regarding the panic buying of large quantities of medicines by customers, and patients try to repurchase using all prescriptions, and there was issues related to the stock and transportation, and there was non-availability of cosmetic products and imported medications. And it was difficult to facilitate door delivery, especially I think it was difficult for them because of the staffing and other issues, like they had to ensure door delivery, especially for their elderly people as well as their normal customers. And restrictions for analgesics and cold products, restrictions from wherein they have to record like the number of tablets of paracetamol that could be issued was limited, and again they have supposed to record it, right? And absenteeism from staff because of concerns of getting infected, And use of mask, face shield became a personal convenience, and they were worried about infection. Of course, like though it is for their benefit, like in an Indian setup, like during April or May, when during the summer, I think like when pharmacists have been working in a situation where there is no air conditioning, definitely like the face shield or the use of the mask are causing an inconvenience as well. But these are things we have to manage, and ensuring the customer crowd are being managed. In many of the pharmacies, I don't think like though we talk about physical distancing, there is enough space to ensure that there is physical distancing, right? And many times the patients from the major hospitals have been shifted to the local hospital, and accordingly the type of medications required in a community setting changed, and accordingly the pharmacist has to make sure that they have been made available. The clinical pharmacy setup in India, again, I discussed with one doctor, a clinical pharmacist in India. So the challenges that he was mentioning is that they lost the area of practice, and because they're not going for ward rounds. And again, the lesser number of patients were admitted to usual illnesses. And again, in the hospital, like they don't have access to the patients remotely, patient data remotely. Like in places where they have access to the patient data sitting at home or sitting in the clinical pharmacy department, definitely they will be able to do the review. So in those places where the patient data is still in the hard form, in the patient record in the hard form, so it is not possible to review the prescriptions and make recommendations. Opportunities like the collaborations with clinicians has gone more digital, and a lot of drug-related queries was been received by the clinical pharmacists during these agents, especially regarding the COVID. Hospital pharmacy setup, again, I discussed with I think it was the head of the department of the hospital pharmacy. The challenges that has been faced that the doctors consult patients over phone and give oral instructions. And many times the patients comes with the oral instructions to the pharmacy. And in the prescriptions of scheduled drug were written out the right presentation format. So the pharmacists were in a dilemma. How can they dispense a medication, the scheduled drug, without a proper prescription? And many MPGs were been newly posted on duty, who are not familiar with the hospital formulary. So they used to write medications outside the hospital formulary, which was difficult to be, which was not available, or that has to be substituted or discussed with the doctors and make substitutions and all, right? And one thing that the hospital pharmacists were mentioning regarding what he has observed is that there were lesser number of respiratory diseases, right, other than COVID, because people have been using masks, less of dust allergy, and again, people have been less exposed to the other cold or other respiratory infections, right? So the medicines that are related to the diseases has piled up, and this needs to be returned. But they have seen the opportunities as well as positive side that the patients were not, since the patients were not able to meet the doctors, they used to consult the hospital pharmacists on various matters, right? Something which was not happening earlier. So this has been happening. And he felt like the people recognize the hospital pharmacists or pharmacists in a better position right now. So it was about from India, like this is what I observed, or like based on the discussion with community pharmacists in USA, in Florida, in USA. The challenges that they have faced is shortage of essential medications, and there was loss of jobs in public, and thereby the loss of insurance, which leads to medication non-compliance. And since both the patient as well as the pharmacists were been using face masks, and countries like US, like there are people from different immigrants as well as people from different areas, right? So thereby the access might be different. So they find it difficult to discuss with the patients of different accents when both of them have been wearing masks. Opportunities that pharmacists observe that it's increased importance of pharmacists, whereby more students will be coming up or joining this profession. And the pharmacists are offering COVID tests, further recognizes pharmacists as frontline health workers. And more pharmacy jobs have been available because there was a need for pharmacists in every sector. And more consultation from the patients regarding the OTC medicine management of COVID symptoms as well as the other illnesses. In the hospital pharmacy setup, from a hospital pharmacist in Chicago, challenges is non-availability of protective measures in the initial stages, And when no patients were initially on ventilator, those medications which are required for ventilated patients ran out of stock. At the same time, they have observed some opportunities they understood regarding the method of introduction of investigational drugs. They understood that the more clinical contribution of infectious disease pharmacists in decision making and more queries from the doctors to the pharmacists. And information I gained from two community pharmacists in United Arab Emirates, UAE. Challenges: the scarcity of facial masks and the price hiked up to 10 times. This led to consumer aggression. And they were worried regarding the threat of COVID infection for themselves as well as the risk to the family members. Increase in anxiety, stress, increase in workload. And it was difficult to ensure that the people kept social distance. And many times when they were informing the patients to wear the face mask, they were not happy about it. And sometimes they had to fight to ensure that they wear a face mask. I think even from the pharmacists from US as well mentioned sometimes regarding it. And the pharmacists had to update their knowledge to give correct information to the patient, right? And there was increased demand of telemedicine and delivery of medications to the patient's home. Opportunities: they gained more experience in tackling an adverse situation as well as to adapt easily to an adverse situation. They gained motivation by increasing the confidence and relieving the fear of public about the pandemic. So the public used to come and discuss things with the pharmacists. This has increased their confidence and they felt like they are part of the healthcare team and they have been able to motivate as well as provide confidence to the patients. They acquired more knowledge about the pandemic. They had come out with new methods like telephonic counseling to people who are not able to come to the pharmacy. And they identified that people are more appreciative of their advice as well as counseling. And this is from the hospital pharmacy setup in Oman. The challenges: managing the pharmaceutical delays and shortages. So we should understand, like especially countries like UAE and Oman, like who have been depending upon imported medications to a good extent, right? So definitely, like these things have been a major factor, a major a factor which has been affecting the daily activities, right? But probably like in India, like we will not be facing this to good extent because of our strong pharmaceutical production industry. And many times the COVID-related medications has to be mobilized to the areas wherein like the COVID patients were been treated. At the same time, there should be a control process to prevent misuse. For example, if the use of hydroxychloroquine or other agents like that has been shown initially like some promise, and people have been started using it, right? So there should be like some sort of control over who have been using it and all those aspects. And they had to ensure like only the minimum patients who have been waiting in the waiting area to facilitate social distancing. And these were the methods they identified to tackle the challenges: the WhatsApp generated, medication generated request, and patients who have been SMS once the medications have been packed. Don't come in advance, they come when the medication is already available. They take it and without any interaction, and the advice was provided through WhatsApp account or preparing special educational videos. And for daycare patients, the pharmacists had to go to the daycare center and thereby providing with them the medications to avoid their visit to the pharmacy. The clinical pharmacy setup in Oman, the clinical pharmacists worked online, mostly doing their reviews over here. Like in Oman, like all the patient records has been online, so they were able to do it from the clinical pharmacy department. And sometimes the clinical pharmacists were being given proxy privileges to access the electronic patient records from home. So they were reviewing the prescriptions and they were making recommendations and all those things from home. Like there are provisions wherein like the pharmacists can make recommendations, they can make suggestions within the electronic patient records itself. So they were able to review, they were able to make recommendations within the medical patients' records, either from the pharmacy, clinical pharmacy department, or sometimes from the home as well. And there were more of COVID patients than non-COVID patients, and accordingly, the activities has changed during this time. So the experiences that was shared by various individuals from various parts of the world, the pharmacists, the frontline workers. So there were positive stories that has been coming up at various period of time, right? So in a survey that has been conducted, 89% of the public saw pharmacy as an essential during pandemic. And the stories of pharmacists working will not be forgotten by many, as well as the pharmacists as well, right? So what we have to think right now, like we have, as a pharmacist, we can see that we have identified like the strengths as well as weaknesses of individual pharmacists as well as of the pharmacy system, right? So basically, if I've been asked, like we'll say that we should take this as an opportunity for pharmacists for better realization. Where do we stand as part of the healthcare system? So what role do we actually play? Are we playing a role to what has been expected from the community, right? Or the expectations of the community are they realistic? So there is a time for a better self-realization. And the pharmacist has to identify the lacunae and gaps and should take steps to build over these lacunae and gaps. And right now, we know that like a good amount of public has identified pharmacists as an integral component of healthcare system. In many places where pharmacists have been purely considered as just business people, I think, especially community pharmacists, definitely I think many public, their outlook might have changed when they observed pharmacists being available during a pandemic. So they identified that they are healthcare professionals. And many a times the public has experienced the pharmacist's care. So we used to hear about nursing care or doctor's care, but less frequently we talk about the care that is provided by the pharmacist, right? So many public might have experienced the pharmacist's care, and we should try that encourage members of the public to share their experiences with the pharmacist during this crisis by different media, so that pharmacists also understand where they stand, as well as the public also share what is their opinion about how the pharmacists performed during this crisis. Academicians has something to identify it from these challenges. They need to identify what is lacking in the curriculum and should take steps to fill those missing items, including public health and emergency preparedness and response, right? As we know, like we are not being trained regarding public health or like responding to emergency, right? So academicians has to think like what has been missing, because things which are never imagined has happened. So we cannot say that things will not happen again, or it's going to continue for some period of time. Again in future, we can expect some unexpected things. So we need to be prepared and we need to be trained in those aspects. And administrations should realize what is expected from the pharmacists and should offer better recognition and credibility to the work done by the pharmacists. And the responsible bodies in the pharmacy organizations should show a renewed interest to utilize this opportunity to create a better image of pharmacists and emphasize in the government organizations as well as other bodies regarding the need of pharmacists who have been better qualified and trained for patient care activities, be employed in the patient care settings. Like I'm talking about improving more number of those with a BPharm qualification or a PharmD qualification with their pharmacy practice to start working in the patient care setting. So this is a right time to think about it. The lessons learned, all of us understood like we need to be prepared for the unexpected. And for everyone, this has been a transforming experience. If you talk about an academician, if you talk about an administrator, so anyone, it has been a transforming experience. So basically, we require a multidisciplinary cooperation and information sharing are the key for an effective quality work, right? The flexibility, planning, and coordination skills and an assertive communication and management of emotions will be key to the successful management of critical situations in future. And everyone has understood like every discipline got a unique role to play in the society. Right? If you talk about healthcare profession, like each discipline within the healthcare profession has a unique role to play, right? And we should understand like members of every discipline should learn to accept, right? If you talk about healthcare profession or any profession, right? So I think I should concentrate more on healthcare profession. We need to understand that members of every discipline should learn to accept, understand, acknowledge, and respect the roles and responsibilities of others, right? So everyone was been involved in managing as well as continuing to manage the situation. So it was not possible to manage the situation to this extent if people who have been working independently, right? So only because people have been working together and people who have been appreciating the others' work, they were able to manage to at least to this extent. And I think this is the time, the ultimate measure of a man is not where he stands in moments of comfort and convenience, right? Where he stands in times of challenge and controversy, right? To a good extent, I think the pharmacist has proved right in this aspect. But again, there are many things that we need to learn where we have to build upon many aspects. So definitely we need to acknowledge and respect the services of all, not only healthcare professionals, the non-healthcare professionals involved in tackling the ongoing crisis. So they are the real heroes, right? And our pharmacy colleagues who are putting lots of efforts and at many times working tirelessly behind the scenes, right? So many times it was not being seen, right? For example, someone who's working in the hospital pharmacy, within the hospital pharmacy, right? People are not aware like how exactly they have worked. Probably someone who has been working in the stores, right? The public has not realized how hard them, right? So they need appreciation, acknowledgement, and support from all of us. And we have to ask this question: are they getting the due recognition that they deserve? Right? Our pharmacists and people who have been involved in it, are they receiving the due recognition that they deserve? It's a question that we need to ponder. Right? Let us hope that when this pandemic is over, things will never be the same, because we are better human beings living in a better world. Let us hope things will be better and all of us will be better human beings living in a better world at the end of this pandemic. And thank you very much. So these are pictures from my place, like in Israel. So this is of sunrise. And this is how the mountain looks after, as well as the sky looks after rainfall, which happens only once in a while. So let us hope what has been shown here, after the pandemic, things will be beautiful as shown in these pictures, right? And I think my presentation will be incomplete unless I acknowledge the contribution of these individuals from various parts, or the frontline workers from various parts of the world, like Dr. Surali Rajan, clinical pharmacy staff in India, and a community pharmacist from Kerala. From UAE, pharmacist Shibiaman and pharmacist Marwa El Said, who are the community pharmacists. From United States of America, Dr. Sonia Joseph, community pharmacist in Florida, and the hospital pharmacist from Chicago, USA, and from Oman, Dr. Amna Al-Hasher, who is the deputy head of the hospital pharmacist and clinical pharmacist from Sultan Qaboos University Hospital. Right, so I will not be able to provide these details unless I get this information from these frontline workers. And these are my contact details, in case if anyone wants to contact and discuss anything. And thank you very much for the patient listening. I'm not sure whether I was, did justice to what was being expected. So I tried to summarize this whole amount of detail that has been available, because when I was searching for the information on pharmacists and COVID, there was almost 132 articles, right? So I had to streamline it, coming down to minimum number of articles and summarize it to this level, right? And thank you once again for giving me this opportunity. I think right now the session might be open for discussions or if any questions that has been raised by the participants, and I'm very well happy to answer in the best way possible. Thank you, and thanks over to you, the organizers.
Thank you so much, sir. It was a very informative session. So, any questions? Now it's time for interaction. Participants, if you have any questions, you can ask now. Our speaker is ready to answer. Sir, we have a message to you by Nikhil NK. Thank you for an informative session, sir.
Okay, thank you. Thank you, Nikhil.
Also from Azia Shazna, great session, sir. Thank you.
Yeah, thanks.
And also from Sri Sailan Keshetti, excellent session with good information, updated data collected from rare sources.
Yeah. Thank you, Mr. T.
Devinder Kumar, thank you so much, sir. Very informative session.
Thank you.
Participants, is there any questions, doubts? There's a message from Dr. Sarfaraz J. Hashim, sir. Very much inspiring. Thank you very much, sir, for your efforts.
Yeah, thank you, Dr. Sarfaraz.
And also from Shaznia TK. Thank you, sir. Nice session.
Yeah, thank you, Mr. Shaznia.
Then Mohammed Hashim M. Fabulous one, sir. Thank you, sir. Very informative.
Thank you, Ms. Mohammed.
Participants, is there any doubts? Is there any questions? You can write it in chat box. Okay, sir.
Yeah, Dr. JB, if no one else is asking, let me ask you one question. First of all, thank you so much. It was a wonderful session. In the sense, it was a huge session. Actually, it is a huge amount of information you had to give, which you have put very nicely in a nutshell. Because challenges and opportunities of pharmacists is never ending, given the fact that there are so many different status of pharmacists working at different levels. And to bring everything on one, this one is very difficult. Thank you so much. And you have mentioned about the vaccines which are going to come, and there are some doubts about the vaccines, why it is not coming and all that. Okay. You put one last question. Are the pharmacists getting the recognition which is due for them? So regarding them, regarding that question, what is your own opinion? I'm putting the ball in you. Yes.
Again, it depends upon where exactly we have been functioning. Like if you, because I've been working here for a long period of time, and from Indian perspective, we should understand. I think I should be really open in saying that, like, pharmacists are not getting the recognition that we are supposed to get, right? And though, like, we are trying in many ways, for example, like by involving or introducing PharmD, so as to the pharmacists are involving in the setting. So even after 10 years, I think in 2008, like at the time, like when I left Manipal, at that time, so we were introducing PharmD. But we feel quite sad to see that, like, even after so many years, almost 30 years, like when we have people from informed clinical pharmacy as well as PharmD, like they're not being regularly appointed. Like, of course, they're getting appointed as clinical pharmacists in some places, but I don't know, like, where exactly is the problem. But I feel like there should be some more initiatives. Because we don't know about the administrative aspects, but again, that's I was stressing on one factor. So this is the time wherein like the people has identified the role of each and everyone, right? The doctors might have identified the role the pharmacist has to play. Because when the medications were being dispensed as well as were made available without hindrance, no one realized the role of the pharmacist. It was almost like something like an automatic system. When all of a sudden, like the medications that was required were stopped, or there was a need for, there was no information available for medications to be given, people started depending on each other, right? So if you take the other countries as well, there was a need for pharmacists to be involved. Even if you take the case of public as well, like people who never used to consider pharmacists as a healthcare professional, definitely they consider now as a healthcare professional. So this is the right time when, like, we should build upon it, and everyone, right? Everyone has to build upon it by providing proper information and pushing upon wherever required to ensure that a better recognition for pharmacists. If you talk about the status as well as financially as well, right? So there should be a better recognition. At the same time, there is one side of the coin. The other side of the coin, the pharmacist has to ensure that whatever they are providing should be a quality, like something which is worth to be respected by the individuals. So right now the pharmacist has provided something which is respected by the public or the healthcare professional. They have to continue it and they have to build upon it. And so definitely, I think on a long run, things will be better. But compared to, again, I should say that I've been working in Oman from almost 10 years, right? The amount of appreciation that the farms, of course, everywhere, all over the world, the pharmacists do face problems with recognition. Even in US, people will say the same thing. Like though it's pharmacy is been developed for so long years, but still the people over there, they will say that sometimes they feel that they are not being properly recognized, right? So, but of course, but compared to in India, in a place where the clinical pharmacist has been introduced or like pharmacist is been there for a long period of time, I feel like there should be more recognition as well as more involvement of pharmacists in various aspects. If you take the case of, I was mentioning about emergency medicine, right? Or public health, like pharmacists, are they involved in any of these aspects? Limited amount, right? But now, when there is an adverse situation, people understood that the pharmacist should be made available as well as should be into the stream, right? So that is my opinion. But again, if you want to talk about this, like you can talk for a long period of time.
No, exactly. You know, it's always there, and there are always room for everything.
Everything.
Thank you so much.
Thank you.
Vijita, any more questions?
No, sir.
A few people has raised hands. I'm not sure.
Fatima Naza is raising hand. Please, you can ask question, or you can unmute yourself and ask question, or put in the chat box.
Shaznia TK. Okay. There's a question from Jay Damani. Thank you. Not a question, it's appreciation. Thank you, sir, for this wonderful webinar. Learned a lot from it. Thank you to everyone who has helped forming up this webinar.
Yeah, thank you, Mr. Jay.
Shaznia TK, what can we, a third year student, do in this pandemic? What kind of role in this time? PharmD students.
PharmD student. Okay, interesting question. Like, I don't have, I haven't included because while I was searching this literature, I saw an article that was written by a former student, I think from US, was writing about like what is her experience during this pandemic, right? So basically, the students as well, like if you see that Shaznia, like definitely, I feel like right from the time when you have joined for pharmacy, right? So you have been identified as a healthcare professional within your community, probably within in your home as well as, and you might be facing various questions from the people whom you are interacting with regarding the disease, as well as regarding the treatment and regarding the use of vaccines and all those aspects, right? So definitely what I feel is that at your level, like at the third year PharmD, right, what you can do is like try to find out information that has been available in literature and be a source of information for around you to ensure that they are not being misguided, they have been given proper information. In case if you're not able to understand what has been written in the literature, so try to discuss with your teacher, but rather than you being misguided, because since I'm telling like because since you are only in the third year, like rather than you being misguided and giving a wrong information. So then, if there are things which you cannot understand, discuss with your teachers, understand it further, so that you are equipped to discuss with your friends or like colleagues or family members regarding the disease as well as regarding the treatment and all aspects. At the same time, always remember, I always keep telling the students, if there is information which is not clear for you, or if you are not sure about, it is better that you tell them sure, because sometimes we feel that when people ask questions to you as a healthcare professional, we have to give some answer. And because if you are giving a wrong answer, you understand that we are giving a wrong answer to that person, and that person is going to give this wrong information to another person. So it is an inflatable pandemic, right? So that pandemic, I'm saying, right? So in those, because you should not be a part of giving a misinformation. So if you're not sure, tell them like I will read more about it, understand better about it, and give you a proper information, right? So that's what I think you at the level of third year can do it. Like, but if there are opportunities for volunteering, right? So in any healthcare setting, if they are allowing you, you can do that. Because I would like to share that, like, over here in our place at University of Missouri, like we have students at the level who are just about to do their internship, and those who are in the final year ask like if they want to work in these COVID quarantine centers, right? They have been allowed to function there, right? So they have been given opportunities, and those who are working there, those period of time will be considered as their internship. So they have been given some opportunities. Have been given some opportunities to and function in these places, right? So I think the best thing is to learn more about it and be an information source, a credible information source for public, right? I hope I answered your question.
Doddaya Hiramat is telling that informative and useful for both students and teachers. Yeah. And there's one more question from Nikhil NK. What can be the challenges and what are the opportunities for budding pharmacists in future if online pharmacy or internet pharmacy comes into exist completely?
Yeah, so that's a very interesting question, Nikhil. Like I think there is a concern that's there for everyone, right? Even before the pandemic, this is a concern that's there for everyone, right? And sometimes when we see on e-pharmacies and online delivery medias, as a pharmacist, we feel bad, right? So as a pharmacist, we feel bad in a situation where, like, when the patients are coming to the pharmacy itself, the amount of interaction that has been happening is limited. So what will be the kind of interaction, or what will be the kind of information that will be passed on to the patients when they are ordering things online? Right? There is a major concern. So right now, the telepharmacy or the online pharmacy, I'm not sure whether you talk about online pharmacy or telepharmacy. If you're talking about telepharmacy, it's basically a setting in which the delivery of medications have been done to the home, or it has been like in some setting. Like for example, sometimes like for the hospital, they make arrangements with the community pharmacy to make delivery to the of medications, or they ask the patients to come to the community pharmacy rather than coming to the hospital pharmacy to take the delivery of the medication. But at the same time, there are interactions that has been happening with the pharmacist. So the pharmacist makes an appointment, or the patient makes an appointment with the pharmacist. So they discuss regarding the medications, they discuss, review the prescriptions, they discuss various aspects, and then the medications have been delivered to them, or they've been asked to purchase it from the community pharmacy. So the telepharmacy is different than what we are talking about online pharmacy, wherein, like, I'm not sure how exactly it functions, whether a pharmacist has been really involved in delivering the medication, or is there any interaction that has been happening, right? But telepharmacy, what I have been discussed here, it's a bit different, wherein there is some sort of interaction that has been happening, like in directly to the pharmacy. At the same time, those people who are talking about dehumanization or like the services due to pandemic, they've been talking about it has to be humanized. Once the pandemic is over, it has to be humanized to a good extent. So we cannot replace the compassion, we cannot replace the kind of interaction that has been happening with the pharmacist as well as a patient. So right now, like I have seen that before this topic was been, I've been reading this topic while I was interacting with my friends who are working in different places. I felt like they were happy that patients have been depending on pharmacists. They have been able to discuss with pharmacists and been compassionate with the patients. The patients have been satisfied and the pharmacists have been satisfied. So we cannot, no way, replace completely the human touch of pharmacy. Though people have been trying to do that by online pharmacy for the benefit and all, like so that's the like we have to build upon, as well as to ensure that when you are providing a proper service, or the patient is being getting a real benefit by coming and interacting with the pharmacist. So definitely, even if the online pharmacy is available, definitely prefer to come to the pharmacy, discuss with the patient, have a human test, understand better. Right? So again, that's what I said. Like it depends upon how we function as well as how we evolve as well. Right? So if you see that online pharmacies have been there, and if we are not evolving and we are not interacting with the patients better, so definitely we can see that people will go with the online pharmacies, because we cannot see a difference between getting medications through online pharmacy and coming to the pharmacy. So definitely things will be different. So that's what pharmacists also has to evolve, and definitely the regulations has to be strong to ensure there should be restrictions on these aspects, right? I hope I answered to your question, Nikhil.
Yes, sir. Thank you, sir. Is there any other questions, participants? Okay. Okay, fine. So thank you so much, everyone. Thank you so much, Dr. Jimmy Joe, sir. It was a very informative and knowledgeable session. Thank you so much. Now I request our principal, Dr. Salimullah Khan of PA College of Pharmacy, to hand over a memento as a token of appreciation to Dr. Jimmy Joe.
Thank you, Ms. Vijayda.
Thank you, Vijita, for this one. And I must once again thank Dr. Jimmy Joe. Time out of his schedule. In fact, when I asked, he had told me that he is preparing for some other presentations. In that tight schedule, he accepted it, and he made it, and he not only made it, he actually covered everything almost which would have been covered for this topic. Thank you so much, Dr. Jimmy Jose, for the generous acceptance of invitation and coming here and presenting. And this is the certificate I would like to present to you. Okay,
Yes,
this,
thank you so much, Dr. Salimullah. Thanks, I really appreciate it, and I feel like everything, even people are involved, right? So the inauguration has become online, the certification has become online. Like even this is a part of evolving, right? So we're not stopping learning, we're not stopping interaction. So that's a good thing. Like when I say that people are evolving, even people in academics, everyone has been evolving in this way. Thank you very much, Dr. Salimullah.
and thank you. Thank you. Yeah.
Thank you so much, sir. Now it's time for end of the session. I request Dr. Mohammed Mubin, professor in PA College of Pharmacy, to deliver the concluding remarks and also the vote of thanks. Over to you, sir.
Okay, thank you, Ms. Vijayta. Good afternoon to everyone. It was informative and thought-provoking session. Our resource person, Dr. Jimmy Jose, rightly pointed out, as the lockdowns are being observed all over the globe, and the national level pharmacy professionals are performing frontline roles. So this webinar highlighted the challenges, opportunities, and role of pharmacists in the COVID-19 pandemic. Pharmacists globally are providing services, especially during this pandemic, including seeing patients and reducing the patient's burden on healthcare facilities such as hospitals, etc. Especially our community pharmacists and their teams are a vital healthcare provider during the outbreak. They remain on the front line of public health by serving as direct points of access for their patients. Hospital pharmacists have an important role during the outbreak in infection control as well as patient care and support. So our resource person was elaborated all these points with proof and evidences. I hope all of you benefited by attending this session. So now I am moving to vote of thanks. First and foremost, I would like to praise and thank the Almighty God. With His blessing and grace, we have made this PACE International webinar a great success. On behalf of PA College of Pharmacy and APTI, I would like to thank our chief guest, today's resource person, Dr. Jimmy Jose, Associate Professor, School of Pharmacy, University of Nizwa, Sultanate of Oman, for his insightful presentation on the topic COVID-19 pandemic challenges and opportunities for practicing pharmacists. Thank you, sir, for gracing this session and for your wonderful intellectual talk.
Thank you very much, Dr. Mohammed.
Thank you, sir. We are very grateful to our esteemed Executive Director, Mr. Abdullah Ibrahim, who inaugurated this program today. And we thank him very much for his support and cooperation in all our programs. Thank you, sir. We are very much thankful to Dr. Ramandang, Secretary APTI, for support and advices which have greatly helped towards the successful organization of this webinar. Thank you, sir. Thank you, Dr. Ramandang, sir. Next, I would like to thank the torch bearer of this event, our beloved principal, Dr. Salimullah Khan, for leading and inspiring us in working towards the goal of conducting this session. I am very thankful to him for his support and at all times. Thank you, sir. We are very grateful to all the participants from various institutions and organizations in India and in abroad. I am sure that the participants must have benefited for attending this program. All of you will receive e-certificate. We will send by email soon. I thank Ms. Vijeta for her wonderful MC, and I thank you, Ms. Aishwarya, for introducing today's guest. I also wish to thank my dear colleagues for their effort and dear students who participated in this session. We are at all times grateful for the blessings and support of our Honorable Chairman, Dr. P.A. Ibrahim Haji. Okay. I'm recognizing the presence of Dr. Safra Hashim, who is the Academic Director of PAET, PA Educational Trust. Thank you, sir. And also
thank you,
the
Dr.
various
Mubin.
heads of institutions also, they were participated, Dr. Sabraya sir and Dr. Salahuddin, and also Dr. Manjunath sir, so many others. Okay, so I'm giving thanks to all. I also wish we are at all time thanks again to all of you for making this webinar so memorable and successful. Thank you one and all.
Thank you, sir. I, Vijeta Pujari K, will be signing off. Thank you.
Thank
very
you,
much.
Dr. Mubin. Especially we need to thank Dr. Mubin also. Thank you, Dr. Mubin, for
Thank you, sir.
for being with us and also providing us support in various forms. And Jimmy, Dr. Manjunath Shetty is appreciating you.
Yeah, it's also sir. Dr. Manjunath, after a long time. Yeah. So
how
thanks
was
for
supposed to come? I don't know. He did not come. I don't know what happened.
Okay, yeah. So thank you once again, Dr. Salimullah, as well as everyone who has been involved in organizing it. It was really wonderful as well as experience. Thank you. Hopefully, in future as well, we will interact.
Thank you so much. Whenever you visit, please do come. Do let me know. We will have we will have a chat maybe or a live program sometimes.
Yeah, hopefully, yes. I will also try. Definitely, I would like to come back for some time to visit Mangalapuram as well as Manipal. So we had plans this year, but unfortunately,
yeah.
next,
Right.
hopefully, inshallah, next year.
Right. Thank you.
Okay.
Thank you.
Thank you very much.
Thank you.
Okay, thank you. Bye-bye.
Hello. Wa alaikum assalam.